This is a demonstration of a UniMocX-enabled PowerPoint presentation. UniMocX is implemented as a set of ActiveX controls that can be embedded into PowerPoint, web pages, and other applications. It consists of a UniMocX control that performs all the calculations of a particular simulation, chart control that serves as a bedside patient monitor that can display charts of any parameter from the simulation that you wish, digital gauges which can provide information to the user from the simulation, a slider control which allows you to make continuous adjustments of the simulation's behavior, a button control which allows you to turn on and off certain simulation behaviors, and an animation control which allows you to synchronize an animated GIF to the simulation timing. Note that these three controls are consistent in the representation of the simulation's biological heart operation at 75 beats per minute. If we increase the heart rate using the slider to 124 beats per minute, again we get a consistent representation of the simulation's behavior. This button has been programmed to increase the heart rate to 140 beats per minute, and again we get consistent behavior among the display controls. One of the advantages of UniMocX is that it's able to simulate mechanical circulatory devices. In this case, we have a patient that has cardiomyopathy, very low left ejection fraction, 10% or below, very low cardiac output. So let's first intercede with a balloon pump. Note that the aortic pressures show the characteristic signal of a balloon pump implanted patient. We've increased cardiac output to about 4 liters per minute, and we've increased our left ventricular ejection fraction by about 50% by reducing the afterload. Instead of the balloon pump, we could implant a left ventricular assist device. In this case, we're simulating a Thoratec HeartMate 2 device, and you can see by the aortic pressure trace that we have very low pulsatility, as one would expect with this device. Cardiac output has been increased to about 4.5 liters per minute. Left ventricular ejection fraction will vary quite a bit depending on how you've set the VAD up. If the VAD is set up to have its input from the atria, then you'll essentially get no ejection fraction because we'll be starving the heart for any blood. If we set it up at a higher flow rate for the LVAD, we can also reduce the ejection fraction to 0. If we have biventricular failure, we can implant an artificial heart. In this case, we're simulating the Syncardia total artificial heart using the Companion 2 driver. Note that we're having a much higher heart rate than we did with the biological heart, in this case about 125 beats per minute. There is no EKG since it is a total artificial heart. Cardiac output hovers around 6 liters per minute, which is fairly standard for the artificial heart in operation. The ejection fraction is sitting at 100%, which again is a standard method of operation for the total artificial heart. Another advantage of UniMocX is that you can simulate multiple patients simultaneously. In this case, we've added just a separate UniMocX control, and that UniMocX control is being controlled by this slider, and the digital gauge and the chart are getting its information from that control. So if we increase the heart rate for this second control, see we're going up to 118 beats per minute, which is demonstrated both by the digital gauge and the aortic pressure trace. Yet we've not changed at all what's going on with our balloon pump implanted patient. Again, we're simultaneously simulating the two patients. This can allow you to compare and contrast between a well patient and a sick patient, or a patient under therapy and a patient that's not. Thank you for watching. You can get your copy of UniMocX at www.unimox.com. You may find other simulations and videos there that are of interest.